It's Dr. Toker coming to you with a public service announcement. I am driving around and getting ready to run some errands in public spaces. And I, like many of you, have heard all of the concern over the recent coronavirus issue. And since my background is not just medicine, but I have a master's degree in microbiology, so I do take interest in some of these public health concerns in regards to infectious disease. I figured it'd be a good opportunity to go over what the problem is and how we're going to stay healthy, and then what our policy in the office is going to be to keep everyone safe and keep everyone productive. So first of all, what the heck is coronavirus, and what is the implication to us? So first of all, coronavirus is another name for a family of viruses that normally cause the common cold. And everyone has had a common cold. You know there's no cure for the common cold. Chicken soup maybe, and you sit and wait for it to get better. There are versions of this coronavirus that can live in animals, such as dogs and cats. And on occasion, a version of a virus that lives in an animal will mutate inside the animal and have the capability of infecting human beings. And when that happens, it actually has some pretty significant side effects to the human, much worse than the common cold. And this current coronavirus happens to be one of those types of viruses that we call a zoonosis. In other words, it's an infection from another animal, basically. They believe that this comes from a bat, sort of like the SARS virus, which was also a coronavirus, also from China. So we can argue about whether or not the virus is genetically engineered, whether or not this was a spontaneously generated virus from a bat. We can be upset at governments for hiding information from us, et cetera, et cetera. A lot of those types of discussions sort of add to public panic and can actually make the scenario from a public health standpoint worse. And so the best thing that we can do is kind of understand what's going on and then take a rational approach to it. Okay, so if there is no cure for coronavirus, the best thing that you can do is prevent it. That's why it says an ounce of prevention is worth a pound of cure. This is a virus that you can have no symptoms when you have it. You can have a mild fever, or you can go into respiratory failure and die. The incidence of the respiratory failure death is around 1%, they think. Who really knows? To be honest with you, there are a lot of people walking around with this virus that have not been tested, which means the percentage of people who get respiratory failure and death is probably lower than we think when you take overall population infected with the virus. Okay, so having known that, it should not be the zombie apocalypse that people are turning it into. Things that you are doing right now for your family, some of them are helpful, and some of them may actually represent a public health danger. And so it is important for you to know the following things. First of all, do not buy surgical masks. You're not preventing yourself from getting infected with a surgical mask. You're only denying the healthcare system surgical masks. We use those to protect patients during sterile procedures from us. So a surgical mask does not protect you from a disease. A surgical mask protects the people around you from a disease that you might carry. So if you want one or two masks in case you get a fever that you can wear on your way to the doctor so you don't get other people around you sick, there may be some validity to that, but wearing a mask every day like you see on TV is doing nothing except preventing a doctor somewhere from having a mask and protecting his patients, or her patients. I shouldn't be a sexist since I'm a doctor who's female. Okay, so no surgical mask, completely not necessary. The other thing that you should not do is demand on a test when a test is not indicated, and patients do have a tendency to do this. The test is not a cure. It simply tells us that it helps us with epidemiology. So if you've been to Italy recently and you're showing signs of a flu or fever, you need a test. If this is allergy season and you have your typical March allergies, you do not need a test unless you've been around someone who has been to Italy or a high volume area or has tested positive for this virus. The reason that's important is because there are limited amounts of these tests. There are limited amounts of doctors who can do the test, labs who can run the test. And for every person with a sniffle came in for a test, you're denying a test from someone who actually needs the test. Okay, so be wise with your healthcare dollars during times of mass casualty. So in other words, if a bunch of people are going to be getting sick, we don't want to waste resources on people who are fine. So if you do not have any symptoms and you do not have any sick contacts, you do not need to run into Quest and demand one of these tests. And they wouldn't do it anyway, but don't do that. Also, if you are sick and you worry, maybe you went on a cruise recently and now you're sick, don't just go walking into the emergency room or your doctor's office, now infecting potentially all the people in that lobby. So you need to call ahead and make sure that they know you have a risk factor, you've got symptoms, you may be sick, and you're coming in so they can be prepared for you. The other thing that you should do that can help your family is to separate yourself from social events. For example, if you've got bad asthma and you had plans on going to a concert or some, football game or some sort of social event, you might choose to sit this one out, right? This might be the one opportunity where you decide you're not going to go take your trip, even though you bought tickets, or go to the social event. If you are at risk, if you're a risk factor person, who are those people? People who are over the age of 65, people who have chronic medical illnesses, especially respiratory problems, people who are immunocompromised. Those people maybe should change their mind about being in large crowds. Now, you can do whatever you want. We're just saying those people might want to restrict their activities. The rest of us feel free to be social, but then also feel free to be courteous. Right? It's flu season. You should know this anyway. You don't cough on someone's face. You don't sneeze in someone's face. If you're going to cough, don't cough into your hands and then shake someone's hand or open a doorknob. Viruses can live on solid substances, sometimes up to a day or two. They think maybe even up to several days on inanimate objects, such as cardboard boxes. And so it is really important that if you're going to handle a lot of surfaces, to keep your hands clean, the best way to do that is with soap and water. There's a run in the stores right now for alcohol sanitizer, and that's fantastic. Having said that, soap and water is actually better. So if you've got access to soap and water, that's your number one option. If you are in your car and you don't have access, or your kids are at school, the alcohol is a good idea. It must contain at least 70% alcohol to be effective to kill this virus. So they think. Okay, so in a business, such as a medical office, such as my spa or my colorectal surgery office, we are going to keep that place spick and span. Every surface is going to be wiped down multiple times a day with Clorox wipes. The floors are going to be mopped with bleach. The bathrooms, the door handles, the desk, the pens, all of that is going to be wiped down multiple times per day if people are handling those surfaces. So if you are in a doctor's office, make sure you keep your hands clean. You're touching surfaces that sick people by definition are touching. Wash your hands. Don't touch your face. Don't rub your eyes. No. Or kind of do one of those things. It can be a habit for some people to touch your face. Don't do it. And also, if you've got access to Clorox wipes and you own a business, let's say, coffee counter or something. Wipe that down frequently. That way we can prevent the spread of this ailment. The other thing that is my commitment, and it always has been, that if you are not feeling well, don't keep an appointment with me. We're not going to charge you a cancellation fee if you have a fever or a cough or some sort of symptom, because I don't want you getting anyone else sick. I'm a surgeon, so my patients are not sick in the office. They are healthy people, and once you've had surgery, you're immunocompromised, so I don't want my healthy patients who've just had surgery exposed to someone sick. So if you are sick, don't come in. Cancel. If one of my employees is sick, they don't come in to work. And in fact, many of them will work from home. I do set up a internet phone system so that they can take phone calls and make appointments remotely from home and still earn a living. Also, we'll be instituting in my office some telemedicine so that if I don't need to do a physical exam and we are just offering advice or going over labs or explaining a surgery, we can do that by teleconference. And that way you don't have to leave the house and worry about getting around sick people and that sort of thing. Alrighty, so that's our public service announcement. This really applies not just for coronavirus, to be honest with you. You're much more likely to get the flu. People die every year from the flu. A lot of people die from the flu. It's the same group of people dying from the flu. People with lung problems, people who are older, people who are very young. And so these are the same people who are going to be at risk for this coronavirus. So keep this video, keep it on replay in the cold and flu season every winter. From here on out, okay? Wash your hands. Don't panic. Use knowledge. Ignore what you're seeing on TV about the end of the world, and no human being is going to prevent this virus from happening, okay? So don't be blaming the public health system because there's 1,000 more cases today than there were yesterday. That is natural epidemiology. The people to blame are actually you and me. Right? No government bureaucrat can write a law and this virus not exist. It's not racist. It doesn't care who you are, what you do, how much money you make. It's a biologic fact that human beings live with. And so keep your hands clean. And if you're sick, stay away from other people. Be courteous. All right? Okay. Well, if you have any questions or concerns, always come by. Our spa is lovely and sparkly clean. Come anytime. Bye-bye.